Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about comprehensive breast health. We'll talk with three specialists from this area here in West St. Tammany. Cindy Turner, who's a nurse navigator in the cancer programs of St. Tammany and Ochsner. Melissa Varnado, who's a nurse practitioner with the high-risk breast disease clinic next door to the St. Tammany Health System Women's Pavilion. And Dr. Yasmin Haja, who is a cancer breast disease specialist at St. Tammany Cancer Center, a campus of Ochsner Medical Center. So we'll start first with Cindy Turner. Cindy, thank you for joining us.
Thank you for having me.
Really excited to have you here. You have, decades of experience at the Women's Pavilion, and you are now nurse navigator for patients who are finding their way through that cancer process. So let's talk a little bit about the Women's Pavilion. I mean, it's a breast imaging center of excellence. It's one of only five in the state that are accredited. So it has some badges of honor, but I think more importantly, that's a first step in the continuum. And we like to say for women, but if we're honest, patients, because women and men can face breast cancer diagnosis.
Absolutely.
Can you start us out at the beginning there and walk us through a little bit?
Absolutely. So it's true, we do see men and women at the Women's Pavilion. And the starting point for most women with mammography is with a screening mammogram. And generally that starts around the age of 40, unless there's a strong family history, and then that can be kind of adjusted. But the typical woman would start with mammography around age 40. It's something that we believe should be done yearly, as long as they're in good health and they and their physician agree on that. A screening mammogram is a very low dose radiation test. It's done for women who are not experiencing any kind of breast problem. So the screening is just some standard views that they perform at our facility. Usually the results are read within a few days. And what it's looking for is trying to see if there's any abnormalities maybe that they were not aware of. The difference between a screening and a diagnostic mammogram, which is another type of mammogram we do, is for someone who is experiencing a breast problem. So for instance, if they had an issue like a lump or pain or something like that. But a screening is something that we do recommend that they do yearly in conjunction with their doctor's clinical exam.
Okay, so, and you actually brought up something that I wanted to think about and talk about, because you're right, early detection, screening mammograms, that's a personal responsibility. Each of us needs to just make ourselves go. And the Women's Pavilion is a beautiful spa-like atmosphere to make that 15 or 20 minutes of quick screening.
Right.
A pleasant experience and a good experience for all of the patients who need to have it done.
Absolutely.
And in that spa-like environment, we have, beyond the screening mammogram, what you mentioned, there are some really in-depth diagnostic tools and some specialists.
That's right.
So that if something is found in that screening mammogram,
Yes.
or if a patient and their doctor have found something suspicious or concerning,
Right.
then we can move into those diagnostic tests.
Right.
And so aside from diagnostic mammography, can you talk a little bit about what else is at the Women's Pavilion in that regard?
Yes. So if a woman has to come back in for something they found on the mammogram, they might be called back for that additional, more specialized mammogram, which we call a diagnostic mammogram, or a breast ultrasound. And those are two tests that will be done kind of simultaneously. The radiologist will come in and explain the results to the patient while they're there, to try to figure out, is this something that's just a benign condition that we can watch and sort of watch it for a period of time until it's stable, or is it something that's more concerning that we might need to progress to a biopsy for instance, which we do there at the Women's Pavilion. And we have a couple of different modalities that can be done through special mammogram type of biopsy or an ultrasound guided biopsy. And we do have breast fellowship trained radiologists who are actually reading those and interpreting those test results right then and there with the patient and trying to explain them fully so that they can kind of ease their mind of what is happening to them. There's also, coming to the Women's Pavilion soon will be on-site breast MRI. At this point in time, we do it at another location, but our radiologists, our breast-trained radiologists are actually the ones that read those tests as well.
Wow, okay, so we have screening mammography that helps us with early detection, gives people the peace of mind of knowing everything's healthy, everything's fine, or in the case of a finding, leads them into a process that you as a navigator can help them to find that way forward. And that may mean a follow-up mammogram, which is a diagnostic mammogram.
Right.
Or it might mean ultrasound, it might mean ultrasound-guided biopsy, it might mean mammography-guided biopsy.
Right.
And it also might be breast MRI.
Yes.
And all of those capabilities are within St. Tammany Health System in Oxnard through the Women's Pavilion or the hospital or the Cancer Center.
That's right.
And the breast-trained, the fellowship-trained breast specialists in radiology
That's right.
are working there full-time at the Women's Pavilion to read those tests, to look at those images,
That's right.
and to help with the diagnosis. And that helps you as a navigator help this patient work their way through that process.
Absolutely.
Well, that is wonderful.
It's great.
So I'm thinking about, we talked about the spa-like atmosphere of the Women's Pavilion and how pleasant it is. And that is sort of the hurdle there, is getting patients to choose to come in and get
Right.
that screening mammogram done.
Right.
And so there is some outreach into the community that we can talk about, and that is something called the Be Well Bus.
Yes.
And that's St. Tammany Health System, through a federal grant, was able to purchase this mobile health unit. And
Yes.
one of the most specialized things that the unit does is mammography.
Right.
And so that's a partnership with the bus and the Women's Pavilion, because we need those mammography techs
Yes.
to be a part of the team when we're out doing
Absolutely.
mammography in the field. Can you talk a little bit about what it means to really get out there in the field and bring that level of care out to the
Yes.
community?
Yeah, I'm really excited that we are part of this program. I had the chance to tour the bus at a recent event we had there, and it's a beautiful facility. It's really state-of-the-art. The mammography that you receive in that bus is just like the mammography you would receive in the building. It's an opportunity for women, I guess, who may not have insurance or may not have the ability, or even if they do have insurance, but it's bringing that opportunity to them. It's, as women and men, I'm sure, but women especially have a hard time trying to balance getting their own health care done compared with working, taking care of their family. So sometimes it just escapes them and they don't think about it. So being able to be present in the community and having it in front of them, I think is a huge asset. And the technologists that are operating the mammography in the bus are top-notch. We have amazing technologists at the Women's Pavilion, both with mammography and ultrasound. They're very highly trained, and they work very well with our radiologists. So I feel like the quality that they're getting in the Be Well bus is top tier. So I feel like it's a blessing to our community.
That is really something, Cindy. Thank you for telling me that. So inside the bus, you have 3D mammography. And inside the Women's Pavilion, you have 3D mammography, and you have those highly trained, specialized technologists who know what they're doing and do this all day, every day.
Right.
And when they're on the bus, it's almost like a field trip. They get to go do what they do out in the
Yes.
field.
I know. I'm
That's
a little
pretty
jealous.
exciting.
It's great.
And I think it's good too, because as you mentioned, sometimes it's a time factor, but I think also that bus can go to areas that are further away from Covington. And so for people that the travel into Covington may be burdensome, or getting off of work can be an issue, if we can bring that bus into a parking lot in Folsom, for example, or Madisonville, or out in Lacombe, then we are able to bring the excellence of the Women's Pavilion diagnostics screenings out into the field.
Right, and that's a huge benefit. We have a lot of rural, communities here that I think really benefit from that.
Beautiful. Well, Cindy, thank you so much for coming in to talk to us about breast cancer, about the Women's Pavilion, and the Be Well bus.
Absolutely. Thank you.
Happy to have you. You're watching Healthy Living, brought to you by St. Tammany Health System, and we'll be right back.